Nicola Hill. Nicola, I know that other European countries have reported new strains of the coronavirus. What do we know about this one that Health Secretary Matt Hancock has been talking about?
Yeah, this is a strain that's got a variety of mutations on it. One in particular is a mutation on the spike protein. It's an N510Y mutation, if you want to know the exact name of it. And he's obviously said that because of this particular mutation, it seems to be spreading very rapidly around London and the southeast, and that's why he's decided to put London into tier 3. So is this just political science or is this reality? Well, a lot of scientists have definitely weighed in on this and been talking about this morning. And the overarching feeling is they don't really know. The fact that there's always lots and lots of different mutations. Apparently there's been thousands of mutations of the SARS-CoV virus since we first discovered it. But this particular one is a little unusual, and as I said, it's because it's affecting the spike protein, and that's why they flagged it up. Now, Professor Nick Lohman from Birmingham University says it is concerning. It's something that they need to investigate a lot more. They want to see whether it does have any impact. But a lot of scientists like him also say that viruses do mutate. They have to do that, they change. But often when they do this, it doesn't mean that they become more deadly, they often become less deadly. The reason being is to survive, the host has to survive. If it keeps killing the host, i.e. us, then it can't survive. And because it wants to spread as rapidly as possible, it slightly mutates so that it can do that, so it can spread around the people, around the country. Now, you might remember, Adnan, that we reported, I think in October, about a different mutation that came from Spain. This was when a group of agricultural workers were spotted having a particular variant. It spread to the local population, and then because of holidaymakers in Spain at the time, it spread much more widely, ended up in Ireland, in France, in Switzerland, and here in the UK. That was because of people's behaviour, because of lack of social distancing whilst on holiday. Whether the same thing has happened here in the UK, in London and the southeast, lots of allegations that people aren't sticking to the rules, and whether that's why this particular strain has spread so quickly, we don't know at the moment. But it's definitely something that's being monitored. Lab tests will be carrying out at the moment, and the consortium that spotted it have actually said on Twitter that, you know, it's because of everybody working together, it's because of all the monitoring that's going on, that in a way that's a positive that they're able to pick this up so quickly.
Nicola, do the scientists know how long it might be before they find out whether the mutation might be in some way resistant to any of the COVID-19 vaccines that are out there?
Yeah, that's very much the question we're all asking at the moment, and the short answer is no. But what I've been hearing from the people who've been speaking this morning is the fact that because it's the spike protein that the three main vaccines have targeted, the Pfizer-BioNTech, the Moderna and the Oxford-AstraZeneca, would that therefore affect whether these vaccines are still going to work? Now, apparently, they train the body to produce lots of different antibodies against that spike protein. So this mutation might not have such a dreadful effect as that we're dreading. They don't know. They're going to investigate. They did say, this is something that Sir Jeremy Farrers commented on, and also Dr. Simon Clark from Reading University, who I spoke to last night. They did say that it might end up being that we are going to have to produce a different coronavirus vaccine or vaccines each year, as we do with flu, once we identify which is the strain, which is the variant that's predominant for that particular year. And that might be the case. Whether it is or not, we don't know at the moment, but they seem optimistic that the vaccines that we're using, that we've already started introducing, certainly here in the UK and in the US, are going to be effective, but they're just going to have to keep monitoring it.
Nicola, thank you as always. Our health correspondent, Nicola Hill.